I'm Carole Taylor. On this edition of Journal, we take on the urgent issue of crime in our streets, and we do it with Deputy Chief Fiona Wilson of the Vancouver Police Department. There's no denying, even by politicians, that the disorder and stranger violence we see on streets around our province has profoundly upset our communities. Now, there are obviously many complicated causes and many fingers to be pointed at policies or politicians. But where are we at, and how do we go forward? Going way back, the closing of Riverview put many people with complex mental health issues on the street without guaranteeing the support they would need for their health care and housing. Today's guest, Fiona Wilson, actually wrote a report on this topic for the Vancouver Police way back in 2007 called Lost in Transition. As well, there's no question that BC's recent experimentation with decriminalization rapidly brought disorder to our public spaces and limited what the police could do to keep some semblance of order. Now that public use of drugs in certain public spaces has been re-criminalized, has it made a difference? And then we have a court system sarcastically called catch and release that sends repeat violent offenders back out into the community, often to reoffend. Why is that? Is this because it is an intentional policy decision? Or is it a lack of judges or holding space in our jails? Deputy Chief Fiona Wilson, one of the most accomplished and decorated women in Vancouver police history, has spent 25 years immersed in these issues and will join us after this break to give us her perspective on the current situation and possible solutions. Deputy Chief Fiona Wilson started her policing career in 1999, just a few years ago, 25 years ago.
Yeah.
So I'd like to ask you to compare when you were on the street as an officer at that time compared to what it's like on the streets now. What's the big difference?
So I think, a lot has changed in 25 years. From our members' perspective, I think that our equipment is much more advanced. Our members are outfitted with the best equipment. They have, rain gear for the winter. They have the latest and greatest in body armor, and really, really great training to go along with that. In terms of what we're seeing on the streets, the opioid crisis has had a significant impact on what we see in Vancouver. The downtown east side has always been a place where there has been a disproportionate amount of drug use, but the toxicity of the drugs these days is so much different than it was 25 years ago. And of course, we see that in the exceptional number of overdose deaths.
So what is a police officer seeing? I know what I see when I drive through those areas, or I wouldn't walk through some of them. What are you seeing? Is it, you see somebody that's high or somebody that's in trouble? How do you interact?
Well, our police officers take a very compassionate approach to people who are struggling with substance use disorder. But, one of the things that they see that I didn't see to the same extent when I walked the beat in the downtown east side is a prolific number of overdose deaths, or people who are in the midst of an overdose. It's one of the reasons why all of our police officers now carry naloxone. When I was on the road, we certainly would come across people who were overdosing, but not to the levels and the frequency that our members are seeing. And, that's a really awful, traumatic situation for everyone involved, not just the person who's overdosing and not just their friends and loved ones, but also for our officers who are often in positions where they're administering life-saving naloxone, for example. And so I think that's something that's changed as well over time.
Is it more dangerous?
Statistically, our police officers are certainly getting assaulted more frequently than they were when I was back in patrol. It's almost daily I read about our members being spat on or assaulted as they are trying to, in some cases, help an individual, in other cases, arrest a person. So the levels of assaults against our police officers, yes, certainly have gone up. In terms of crime rates, we've seen violent crime rates in the city drop in the last year. But we've also had some very, very concerning incidents that really do lead to perceptions of a feeling of not being safe in our city.
So you mentioned the toxicity, of course, is a huge issue. But we've also been through this experimenting with decriminalization. And I mean, I've lived downtown for 26 years, and the changes in the last couple of years are just unbelievably bad. And then re-criminalizing in terms of a few specific public spaces now. They're not supposed to be shooting up in public. But honestly, Fiona, I walk around a lot downtown, and I still see people shooting up in public. So has it made any difference?
So with respect to decriminalization, I would say that we can all agree it was a failed experiment. Police in this province, including the VPD, were very progressive when it came to the proposal around decriminalization. We, like everyone, have been searching for a solution to the toxic drug crisis and the number of overdose deaths that we're seeing. And that took courage. But it also takes courage to stand up and say, this isn't working. And, police warned the province, even before they submitted the request for the exemption to Health Canada, that the matter of public consumption was going to be a real problem. And we asked the province to address that prior to the exemption request going in, and it went unaddressed. And of course, literally within weeks of decriminalization taking effect on January 31st of 2023, what did we see? We saw these situations of really problematic public consumption. And the difference was police had no grounds to do anything about it unless the individual was in one of the very limited places that was an exception to the exemption at the beginning.
Yes, because it basically said they were legal.
Yes, under 2.5 grams, because the possession was lawful, so was the use. And, we predicted that this was going to be a significant problem, and indeed, it became a significant problem. And we saw some of those, really troubling circumstances where people were, using in Tim Hortons, and, or families wanted to go to the beach and there's somebody smoking crack on the sand beside them and their family.
Or in hospitals.
Or in hospitals, yeah, exactly, Carole, another great example. And so, I feel like police across the province were willing to try, and get behind this progressive approach to try and make some, move the dial in terms of drug overdose deaths. But when we saw what was happening, it didn't take us long to stand up and start very, very strongly advocating for changes to the exemption. And we saw that initially there were 3 additional exceptions added. And when we noted that that didn't really make enough of a difference, we stood up and said, we are going to oppose the continued exemption by Health Canada, because our police officers weren't able to address those issues of really problematic consumption in public spaces. And, our job is to ensure that our communities are safe for everyone. We want to have a compassionate approach to people who use drugs. We think that it should be a health-led approach. But there wasn't the dramatic increase in resources that we were expecting in the wake of decriminalization either. And so, those 2 factors put together led us to stand up about 14 months after the exemption took effect and say very clearly that we could no longer support that experiment.
And so now?
And so now, we are back in a position where we have the lawful authority to intervene with someone who's using in public spaces. There's 3 exceptions, in a drug checking facility, in a private home, or if someone is sheltering lawfully in a tent, for example, in a park overnight. But other than that, public drug consumption is now prohibited again, and the Controlled Drugs and Substances Act is back in force. Unfortunately, I think one of the things that happened with decriminalization is that it normalized the matter of public consumption. And so we have to work now to try and gain that ground back.
Yeah, we certainly went backwards because I am still seeing it. And the issue of safe supply also has bothered me because there was some denying at the beginning that, there's no diversion going on. Mm-hmm. But of course there is.
Honestly, Carole, we have seen diversion of prescription medication, certainly for as long as I've been on the job. I'm in my 26th year now, and I remember when I was walking the beat as a recruit in the downtown east side, prescription diversion has been around for a very, very long time. And I think it's important for us to not conflate the diversion of prescription medication with the diversion of safe supply. Certainly that happens as well, but I think both are a reality. And we try and we're very aware of the matter of diversion. We try to, keep a very close eye on that. Primarily, our enforcement efforts are with respect to the individuals and the groups that are causing the most harm. So the individuals and groups who are producing, who are importing, who are trafficking, but certainly diversion is something that we watch very carefully and have taken enforcement action with respect to.
And there's so much more to discuss, including mental health issues. And we'll be back in just a moment. You can't possibly talk about disorder in our streets without facing the mental health issues that are out there. And Fiona, the first time I met you was in 2007 when you brought to government a report that you had done. And maybe you could talk a little bit about what you saw then and if it's relevant today.
Sure. So in 2007, the Vancouver Police Department published a report called Lost in Transition. And, we were actually the first department in this country to come out and say we were criminalizing people by virtue of their mental illness, because we were running into this situation where we were constantly interacting with people who in many cases were grossly mentally ill. We would apprehend them under the provisions of the Mental Health Act, take them to the hospital, and they would be walking away before our members even drove out of the parking lot. And so we did some research that determined that at that time, in some areas of our city, up to 50% of the calls our members were going to involved an individual who was grossly mentally ill. And, there were a number of recommendations that came from that report. And, I was really proud at the time of the position that the Vancouver Police Department took to really carve out a seat at the table to talk about mental health in community and individuals who are coming in contact with police as a result of their mental illness. And I can say all these years later, unfortunately, many of those issues are still the same. We're still in a position where, we really do need more resources to help people who are in mental health crisis.
And secured care?
So, I've said for many, many years, over the course of my career, I've had the opportunity to talk to literally hundreds of people who have suffered from a mental illness, loved ones, family members. And I can tell you that I think it's very, very important to first say that the vast majority of people who struggle with mental illness will never come into contact with police, will never be violent. But for a very, very small percentage of people who are mentally ill, some of them are dangerous. Some of them are dangerous to themselves. Some of them are dangerous to others. And for people like that, to let individuals languish in community without the resources to help them, I just don't think that's the right thing to do. And so I think for a very, very small portion of people who are grossly mentally ill, who do not do well in community, who need support, we need to have somewhere that's a moderate to long-term secure facility where they can stay and get healthy and be protected, and not only protect other people from potential violence, but we also know that people who are mentally ill are more likely to be victimized themselves. And so for that very, very small segment of the population, I do think that there is a need for secure care.
It's interesting that for the first time that I'm aware of, the two leading parties in the election are both saying the same thing, that there is a small percentage of those that are just in desperate need of housing, medication, food, care. So perhaps, do you think something might happen? Do we need more facilities like Redfish?
Absolutely. So I'm a huge fan of Redfish. I had a chance to tour Redfish with the chief and the other deputies last year. Amazing facility. And when we think of Riverview, we tend to conjure up images of a prison-like environment.
One flew over the cuckoo's nest.
That's right. Exactly, Carole. Redfish is the opposite of that. It is a purpose-built facility. It's an incredibly beautiful environment. It's a compassionate environment. There is job training on site. There's a restaurant that serves healthy food to help people in every aspect of their health and well-being. Individual rooms, caring, compassionate staff on site. It's really quite a place to visit. The problem is it's just over 100 beds. And really, I feel like we could quadruple that and still have a need in British Columbia. So, I think it's a great model, but it does need to be scaled up.
One of the things the police force has done is try to bring in psychiatric nurses, mental health professionals right inside the shop, as it were, to help police.
Absolutely. So one of the areas in my division that I'm most proud of is our mental health unit. It is the gold standard across the country, and a lot of the unit was built up in the wake of Lost in Transition, recognizing that police have a role to play here, whether we like it or not. The reality is, when someone's in mental health crisis at 2:00 in the morning on a Wednesday, it is the police who are responding. And make no mistake, we are always looking for places, spaces that we can remove ourselves from because we're not needed. So our partnerships with Vancouver Coastal Health, with Providence Healthcare are extraordinary. We've had CAR 8687 in place for many, many, many years. In fact, I believe it's over 50 years now. They started it's not true, it's not over 50 years because I just turned 50. And it was 1978. So I was 4 years old at the time that our CAR 87 program started, where we have a police officer and a social worker who work together, a mental health nurse rather, who work together to respond to people who are in crisis. But we also have ACT and AOT. Those are teams that are multidisciplinary that police are part of. We have a mental health unit that is very, very well staffed. And we do all of that in an effort to address those alarming numbers that we saw in 2007 with respect to almost 50% of our calls involving a person who is grossly mentally ill. We also have more recently embedded a mental health nurse in our operational command center. So they can actually look at calls that are on our call board that are mental health related. They can review that call. They can look at the history of the person involved. And if they can refer that incident to a non-police response, that's exactly what they do. So we're also always looking for ways to remove police from spaces where we don't need to be or where it's more appropriate to have a health response in this case.
So with all these complexities and issues and problems on the street, how's recruiting these days?
So, it's interesting, Carole, because across the country, in fact, across North America, recruiting has been a challenge for police for many years now. For whatever reason, in Vancouver, we seem to be a bit of an exception. We've been recruiting and hiring at exceptional rates over the last few years. I think part of that is a reflection of just the appeal of big city policing. We're the largest municipal police department in the province, but also, you know, a department that has a worldwide reputation for being progressive, for having strong leadership. You know, Chief Palmer has been in place now for almost 10 years and is, you know, certainly one of the most beloved police leaders in the country. We are now hiring at a rate of about 1.6. So for every one person that leaves the VPD through attrition, you know, of course, the Surrey Police Service coming on board, we've lost some members who have chosen to go to Surrey, primarily because many of them live out in the valley. So for every one that leaves, we're hiring 1.6. So I'm really proud of our recruiting ability over the last 2 years, particularly in an environment where, you know, it has been very difficult to recruit new members.
Yes, and of course all the baby boomers are, you know, it's retirement time.
That's right.
And it's also interesting that when you are looking at diversity, how diverse the Vancouver force is.
Absolutely. You know, right from our senior executive level down to our newest recruit classes, we are an incredibly diverse population at VPD.
Well, I want to congratulate you for being Deputy Chief.
Thank
It's such
you.
an honor for you to be in that position, and thank you for all the overseeing of investigations that you do and the work, and reminding us all that, you know, the police are trying to do the job the best they can and need support.
Thank you so much, Carole. It's been a pleasure being here.
Thank you, Fiona. We will be back in just a moment. In a survey conducted by SOS, the Save Our Streets organization started by Jess Ketchum, 58% of British Columbians said there are areas of their communities they actually avoid because of fear for their safety. And that number jumps to 64% in Vancouver. The police are in the front lines of dealing with this disorder, but they can't do it alone. Policies have got to change. Let me know your thoughts on YouTube. Till next time, I'm Carole Taylor.